Good morning, everyone. Welcome to the August 30th, 2024 Personnel Administration Higher Education Committee. I'd like to call the meeting to order. First order of business, the motion to approve the prior committee meetings. Supervisor Bean, Supervisor Thomas. Any comments, adjustments? Seeing none, I'll call the question. All those in favor say aye.
Aye.
Any opposed? That carries. Privilege of the floor and public comment. Do you have any public comment for a meeting today? Seeing none, we'll move forward. Sudi Adirondack, an update from the college. Next one. Request items to be discussed by the Human Resources Director, review report of vacancies filled, tracking. That's just normally an informational piece for our committee. Moving on, County Clerk, Amanda.
Yeah, this is a budget amendment just to get ARPA money in the right accounts so that we can pay for Office of Community Services. They have an ARPA distribution that they're looking to collect, so we're just looking to get the money in the right spot.
So we need a motion for this?
Yes, we do.
Okay, so I need a motion. Supervisor Driscoll, Supervisor Bean on the second. Any questions, comments? Call the question. All those in favor say aye.
Aye.
Any opposed? Seeing that, I'm sorry. Sorry,
Matt.
I thought it was gonna be over.
All right, going backwards for a second. Matt, we have a discussion on Warren County benefits.
Thank you very much. Good morning, everybody. What you have in front, well, you have in front of you is a little kit I'm going to review regarding this year's healthcare renewal. Obviously, this is the time of year the county renews their benefits on December 1st. And I'm going to go through a little bit of how we got there. This year, we're going to go through some, obviously, some challenges and what we're facing and some alternatives that we have to look at. So if you want to enter the kit real quick, obviously there's a little information about Marshall and Sterling in there. And if you go into the third page, you can see just my contact information. I had Megan here as well with me. Point being in this, you know, I know we go through some of this stuff rather quickly sometimes. I know you have a pretty tight agenda and a lot going on today. If any of you have questions afterwards on this, you want to review any of this, you want to get a little bit of a deeper dive, I'm happy to do it. Contact information is right in there. So we know, and this is the rest of our team. Obviously, we have a deep team to help. But I want to go ahead in here. The agenda, what we're going to review today, obviously, is a high-level executive summary, looking at the renewal, where the premium equivalents, the rates are going to look like. I want to show you what the rest of the world looks like on a small group basis, what those rates are looking like, what your plan design is. Then we have to talk about what other renewals are looking like your Medicare and your dental plan, things like that. So if you want to turn into the executive summary. So Warren County has maintained a self-insured health plan, as many of you know, since December of 2017. And really throughout that time, I can safely say the county has saved millions of dollars versus what the alternative would have been in being an experience rated plan. We also said at that time, you know, when we were going through it early on, those of you who were there then would remember that you have some challenging years, even in a self-insured environment. You have some peaks and valleys and some challenges. But very confidently versus where you were in staying experience rated, you are 100% on the right track still with being self-insured. I will tell you just anecdotally, we had a meeting with one of the insurance companies recently that went through about 12 renewals with us. And they were experience rated renewals. And one of them was 1 under 10, and the rest were between 15 and 40%, believe it or not. That's for experience rated group. So it is a very challenging market. There's some things we have to review as challenges this year, but I think you're going to end up in a pretty decent spot. Keep in mind too, last year, when I was standing up here, you got the benefit of a pretty decent year. Last year, we only passed through, it was under 3% change to your employees. But let me go through here real quick. The working group. So just as a reminder, we have in here who the working group is, all the members, and the intent of that group really is what we're doing. We're meeting anyhow quarterly to review detailed claims trends, high cost claimants, cost containment strategies, all those types of things. And we are really taking that opportunity. So you all know that working group, the intent is to really drill down there, dig into the claims, analyze them deeply and determine what's the next steps and how you can cost control from there. And then to bring that information to this body, to this committee, to obviously finalize things. But keep in mind that it's all HIPAA protected. We're not talking about any individual people. Nobody sees any of that information, just so you're all aware. So it's going through with some of these peaks and valleys of self-funding, as I mentioned. On the medical side, because you have a medical, and it's all rolls up under one plan, but essentially you have two components of your health insurance, a medical part and a pharmaceutical part. And on the medical side, over the rolling 12, August of 23 through July of 24, your medical claims, so doc visits, hospitalizations, surgeries, things like that, that's up 10% versus previous period. And through that time, you had 12 members with over $82,500 of claims. 2 of them have crossed over your specific deductible, which is $165,000. So as a reminder, being self-insured, the county is only really self-insured or on the hook up to $165,000. Above and beyond that, we have a reinsurer. Okay, so you have limits to what your liability is. Essentially, that's why we pull in a reinsurer to level things off and handle any large risks. Now, I will say this doesn't stand out as being unusual. With having 1,400 members on your plan, you are absolutely going to have a number of people that use it, right? That are going to be high cost claimants. So that doesn't stand out necessarily, but the overall trend is just up. And of course, those 12 high cost claimants are still active and expected to be on the plan into the 24-25 plan year. Where we do see some change, and this is not just for the county, it's for practically every employer out there, is on the pharma side, on the prescription, where your claim utilization is overly still up, but a lot of it is made up of these anti-obesity medications. And you can see it from just 1 year to the next, it was additional $912,000 or really 26% of your pharmaceutical spend is made up of these drugs. And this does not make you, a lot of employers have this. It's a little bit pronounced and it, higher than many in your case, but you can see the list of some of these below. And yeah, that's just a lot of spend is coming from that area for a lot of employers. And you're not immune to that, certainly. So what we want to ultimately, if you look at that next bullet, Highmark has done a good job for us, really, again, since it was, you may recall, it was Blue Shield in Northeastern New York before, turned into Highmark a few years ago. But overall, they've done a decent job for us managing the prescription spend. What we've spent a lot of time in the working group is over the years, not just this, over the last couple of years, we've really spent a lot of time looking at this. We've kind of hit the end of Highmark's capabilities to save the county any additional money on pharmaceutical spend. And we've been investigating other PBMs so we can keep your medical claims through Highmark, and we can go use pharmaceutical claims. We can source those and use a different PBM for those. And what we've been talking about is, since we've kind of hit the wall with Highmark on capabilities, we're looking at keeping medical with Highmark and moving to ProAct on the pharmacy side. Okay. Many of you, ProAct is very big, municipal space. They are a upstate New York company where they're housed, and we have a lot of experience with them. They're good at what they do. They're accessible. And I think a lot of your members are going to be aware of who they are as well. So that is the recommendation coming out. The reasoning is the working group is vetted alternative, as I said. they have other capabilities that can help your members. One of them is going to be fairly simple, is Anna RX as an example. Your members can access drugs through Canada. They have the capability of doing that at costs that are much, much lower to them. As an example, that's a voluntary program. They don't have to do that, but that is an option for them to take advantage of. And there's other options in there to take advantage of. So there's more to talk about here, but I want to pause there because I said a lot. Questions at this point in time? Yes.
As far as the prescription part of it, is that like Highmark is a Blue Shield type product that covered, if someone moves to California or anywhere else, then is that accessible that way? You know what I'm getting at?
Highmark is.
Yeah, but
Yeah.
I'm just saying the working group, this alternative.
Yes, so the recommendation is to keep Highmark on the medical side, which is a national network. So anybody who has a college kid in Chicago or is traveling to California has coverage on the medical side. And on the pharmaceutical side, almost all of these PBMs have access nationwide, and ProAct does. So you can go to any of the big pharmacies across the nation with Highmark or ProAct. We don't see any disruption there whatsoever. Yes.
Just a point for clarification for me. So if I go to my doctor, I'm paying my copay with Highmark. He's writing a script for me, and my pharmacy has would have my ProAct card on file, and that's how it would work.
They would after the first fill.
Yeah, okay, yeah,
Yes.
right,
Yeah,
okay.
absolutely. And I should have said that earlier. If somebody has a $10 copay for generic drugs, it's still going to be a $10 copay or 30 or 50. None of that changes. Okay, as far as what's in front of them. Sometimes even when Highmark took over Blue Shield, there were changes where a drug may be in a formulary class versus non-formulary. There could be some changes with that, as there was every year, every quarter sometimes with these PBMs. So that can happen. But as far as what the copays that have agreed to with the unions and what's in your none of that's changing. Yes.
Given that 26% of the current county spend is on 4 medications, does the Cana RX option provide any reduction for those 4 specifics, or is the prices consistent between Canada and the US?
Those particular prescriptions they're not eligible. Cana RX is going to be for maintenance, brand name maintenance drugs. I'm gonna, categorize that to cholesterol, blood pressure. Those are the types that are eligible for it. Now, what a company like ProAct gives us is they have better access to coupons to help reduce the cost of those drugs for the member and for the county. Okay, so now a coupon, not to go into tremendous depth, but you know what these are to some degree when you hear a prescription commercial on TV. And in the end, they say, if you need help paying for this drug, give us a call. They're generally referring to a coupon. So we have ProAct rather has access to many, many more coupons to help reduce the cost of the drug by, from what it is today.
But that falls on the individual member to take advantage of it.
It's a little bit more integrated with ProAct. Yeah. Any other questions here? So on the renewal analysis, I want to show you a couple of things. And Warren County's budget now for health insurance, and again, hard to judge, but if this was an experience rated plan, I imagine it'd be a $16 million budget. It is in 2024 to 25, the healthcare budget is call it 12.5 million or so, with the number of employees that you've had. So we're looking at really with this, the original call for the increase was 11%. is what the formula called for. And the working group really came to an agreement. You wanted to keep the premiums as steady as you can. We've been able to build up a little bit of a reserve over the years to help subsidize that. So really brought the increase down to 9%. With the fact that we expect with the move to ProAct, there's programs in there to help reduce the cost for the member and reduce the cost for the county. We would hope as we go into next year and subsequent years, some of these moves to save costs will be able to help stabilize this a little more. But we are looking at a 9% increase. Important to note, the when you bear this out over 24 pays, and the fact that the county's roughly paying 78% or so of the premiums, it doesn't work. It works out to be a pretty reasonable overall cost increase for the employees. Now, what I want to show you, and this isn't really applicable to your world, but if you turn the page, I just want to give you a sense for what the primary plan. You have two plans. You have a high deductible plan and a EPO plan, a copay based plan. So those of you that are familiar with the Affordable Care Act language, any of you familiar with, platinum plans, platinum, gold, silver, bronze? Does that ring a bell? That's like for smaller employers. Platinum plans are the best that are out there. Your lead plan that most of your people are on is like a platinum plan. It is very, very good. The benefits are outstanding. So just to give you a benchmark, when you compare, when I show you that next page that has small group rates, this is what platinum plans cost an employer under 100, even whether you're a municipality or a private business. You're about $1,250 or $1,150, something like that for a single person. County, even with this change, is $878 or so. So you're 30 to 40% lower than what the under 100 market is. Again, you're not a small employer, but this is public data. We obviously have access to these rates being brokers. But to give us a little bit of a benchmark of, where you are from a cost standpoint versus that. And, you're 30 to 40% less depending on the tier. You're performing pretty well. Again, you're in the right place without question, in my opinion, versus an experience rated quote. And, last year was 2.9, this year it's 9. So we have a little bit of a bump, but overall you're still in the right place. Want to pause there again. I don't want to move too quick or too slow. I know you have a lot in the agenda today, but good for now. All right, so you have the next page is your plan designs, which I outlined. Again, you have a platinum plan. Those are still very, very good benefits. There's a slide called MAPD. That's your Medicare Advantage. These rates are not available yet. Those of you that you may recall, for a number of years we had Humana, and they did actually a really great job for the county. Saved a lot of money early on. Did a fabulous job. No complaints with them for the longest time. Then they had a provider issues, and the hospitals dropped out, and it just all went sideways very fast. And that hasn't been resolved yet. So they're not going to be back in the mix for I don't know how long. So anyway, we had moved to Anthem rather, for that reason. And we did that mid-year. That just happened in March. But the rates are not available yet. We'll bring those to you as soon as possible. Again, Humana at the time, Glens Falls Hospital, really all the Albany Med family of hospitals were going to be out of network. So that was not an option. Anthem has done a fabulous job since we've installed them. But from a rate perspective, not quite there yet. Moving on to dental. And then once we're almost near the formal part and formal end part of this, certainly want to open it up for more questions. we have heard on the dental side, and I'm sure most of you are aware of it, there's dentists that are dropping out of all of these networks, Delta Dental included. And so we went out to some of the leading carriers in the market, you know, Anthem, Guardian, others that aren't on here. And we're looking to see, okay, can we accomplish two things? Maybe save a few bucks would be great, but plug the network holes would be, you know, ideal. If you had both of those in one place, it'd be the nirvana. When you look on that dental page, you have the dental rates or Delta rates rather, and you see Anthem and Guardian. Anthem is a smidge less and Guardian is 4.2% more. So that's not overly compelling. Make any real disruptive move. The bigger issue for me and for us when we're looking at this, if you turn the page, I know there's a lot on here, but this is the network disruption and the dentists that are listed on the left or the right, those are dentists that are currently in network with Guardian, but would be out of network. I'm sorry, in network with Delta, but would be out for Guardian or out for Anthem. So you would pick up some dentists as in network potentially, but you'd be losing others. And when I look at this list, like Dr. Wasserman and Milsna, you know, these are prominent dentists in our area, and Northeast Surgical is a important oral surgeon in our region. That would be out for both of those. So I don't, would not be a win-win for everybody. To be some winners and some losers, and it wouldn't put anybody in this room in a better situation, in my opinion. So I would say we're recommending, although it's not perfect, still renewing with Delta Dental this year for those reasons. Other things that are reasonably easy, vision is staying the same, no changes to that. Everybody's been pretty happy with Empire from my understanding. Voluntary life is staying the same. The accident plan that you have is as is, critical illness, all as is. The bulk of the decision that, you know, we would need you to make some, you know, to vote on and move forward is obviously the change essentially from Highmark on the pharmacy side to ProAct that the working group has recommended. So that was a mouthful. I don't know if I'm on time or not. I've lost track. So I will hold for questions and we can go from there.
Any questions from the committee? Nate, please.
So to summarize, our members have really good insurance and pretty affordable comparatively. But our premiums are gonna go up $1 million, 70% of which the county pays for. Roughly, we're gonna switch to ProAct possibly, that provide some comfort with prescriptions and stay with dental.
Yeah, that's a fair assessment. When you have, and it's a good point, when your budget is $11 to $12 million, even a 9 or 10% increase is, you know, that's where you net out. And of that, now the important part of this is, and this is super critical, for those of you who insure your employees out of town or anywhere else, you know, when you get a 10% increase, you get a 10% increase, right? There's nothing you can do about it. We have to budget and project forward for the county to protect you from a budget standpoint. We're projecting it at that 9%. It may not be realized. That's the benefit of being self-funded. And you may not realize that. We may have some of those high cost claimants may not be there. The move to ProAct and some of their cost containment programs we expect will save us some money. Okay, so we feel, you know, the ProAct is going to save us some money and it's going to insulate you from future high cost claimants. So yes, it's a step that we're taking for a few reasons. Okay, you're welcome.
Any other questions or comments? Seeing none, I think I need a motion to bring to the floor, Amanda, if I'm correct, changes in our medical plan, primarily in the pharmaceuticals, from Highmark to ProAct, and leave all the others the same. If I got that right, Matt? Is that
Correct.
okay? So I need a motion to bring that to the floor. Supervisor Thomas. Supervisor Etu, any questions or comments about that? Call the question. All those in favor say aye.
Aye.
Any opposed? That motion carries. Thank you, Matt.
Okay, very good. Thank you all.
Item 4, items to be discussed by the Director of Information Technology, Mr. Colvin.
Morning. So today I'm bringing forth a resolution to enter into a contract with Microsoft for our licensing for Office 365. It's an enrollment agreement that we agree to their terms and such before we can actually purchase licenses. Something's been coming for several years. It's gonna drastically increase our costs, and we're just trying to gradually work our way in, and this is our first step towards doing that.
Motion to bring this to the floor. Supervisor Mayday, second Supervisor Bean. Any questions, comments? Seeing none, I'll call the question. All those in favor say aye.
Aye.
Any opposed? That carries. Michael, anything else?
That's all I've got, unless you've got something for me.
That was quick.
Thank you.
Thank you, Mike. Referrals from the Human Services Committee, Supervisor Driscoll. If you wouldn't mind help back up this, or do we have someone else in the audience to help with?
I mean, I can,
Well, like, we have John. John might help us. with
okay,
that
yeah,
also.
go ahead, John.
Thank you, Mr. Chair. So I have told all of you that we were not going to bring these types of things to the committee mid-cycle anymore. We were going to handle these in the budget. However, we're going to have to do this on occasion. These two positions, the reclassification of these positions with zero salary impact enables us to provide testing for these people in the fall. So the test is scheduled for the fall. If we don't have the positions, they can't test, and then they have to wait for another year to test. And so that's why we're asking you to just approve these. And again, zero salary impact. Thank you, Mr. Chair.
So motion to move both. Supervisor Etu, Supervisor Driscoll on a second. Any questions, comments? Call the question. All those in favor say aye.
Aye.
Any opposed? That carries. Thank you, John. County Attorney.
I asked the chair, I noticed the president of the college, President Duffy's here. I'm not sure
Oh,
if she wanted to make some.
of course. Without objection, Chris?
So you're yielding your time, correct?
I apologize. I had 10 o'clock on my calendar, so I thank you for yielding the floor to me for a very brief report. Good morning, everyone, and I hope you're gearing up for the big finale of summer, as we might say, but hopefully not, because we know it can go into September. Classes start next week on Wednesday. I'm happy to report that we continue to see a lot of registrations coming in the final weeks. It's been a little slow this year, partially because of the debacle rollout of the financial aid process at the federal level. So our financial aid team has been furiously working since July to try to help students get their financial aid in order. We're making good progress, and we're starting to see the results of that. Just last weekend, we held a special instant admit day where people can come in and be admitted and enroll right on the spot. And we had 40 students show up on a Saturday in the summer, which is highly unusual, and I applaud my team. Housing, we're over 300 that are expected to move in this weekend, and we expect even more. And so things are looking good coming into the year. We still have a little bit of wiggle room to go, and we expect to be able to meet our budgeted enrollment goals for the year. We also got some great news this week. We were awarded for the first time in 25 years a National Science Foundation grant, which are very difficult to get, especially for the community college sector. And this will be a partnership with the University at Albany and SUNY Geneseo on helping chemistry faculty across the state continue to develop ways to engage students in science education. So we're very proud of our science faculty member, Christine O'Connor, who really led the effort. And this was a big boost to the college in terms of having some new ways to help students engage in the STEM fields, which we all know needs more people. And I think that's all I really had, but I'm happy to answer any questions. I do want to thank the board for approving the funds so that we can move forward on our high voltage project. And so our team is off and running on that. but I'm happy to answer any questions you might have about the college.
Any questions for President Duffy and the committee? Questions?
Thank you so much. I
Thanks,
appreciate the
Chris.
time.
Appreciate your time. Moving on, Larry?
I have 4 action items for the committee today. The first is to amend the county budget. I would sign insurance proceeds which the county received per resolution 204. To sign $900,000 that we received from Continental Insurance to the budget code for future sexual abuse lawsuits. It's a reserve fund that we established 2 years ago when we, as a county, decided not to obtain and continue to obtain excess coverage on sex abuse claims due to the cost. So that would be the first action item. This $900,000 would fully, I don't want to say fully funds it, but it gives us an amount over $1 million for the county to deal with future sex abuse claims, whether they're uncovered or in excess of initial primary policy.
Need a motion and a second to bring it to the floor. Supervisor Ritu, Supervisor Thomas on the second. Any questions or comments? Supervisor Ritu?
Thank you, Mr. Chairman. Larry, does this, you said future claims, can we use this for the 250 and 250 we agreed to pay over year 2 and year 3 for a recent settlement?
My recommendation is going to be no, but that's definitely a budget officer decision and a board decision. And the reason my recommendation would be not to do that is I believe it's hard to fund that account from revenues. This is a unique opportunity for us to fully fund it, but at the end of the day, the board would make that determination as they go through the budget process.
Any other questions? I'll call the question. All those in favor say aye.
Aye.
Any opposed? That carries. Item 2, Larry?
In an effort to have a positive impact on our insurance renewal for 2025, we've identified through our new position, thank you very much for the risk manager position. The first policy is a clear policy to designate how to report accidents, incidents, claims, and litigation in Warren County, because there is no comprehensive policy for the entire county on how to deal with those items. So attached to the brochure is a proposed policy which provides a single report form for the entire county to use for all claims that as they arise or as they're received. This policy, if approved, will go straight to travelers, and it's the first of a number of policies you're going to see over the next 60 to 90 days as we modify, tweak, and streamline liability policies that address liability in an effort to impact our renewal for 2025.
Motion to bring this to the floor. Supervisor Thomas, Supervisor Bean on the second. Any questions and comments? Call the question. All those in favor say aye.
Aye.
Any opposed? That carries.
The third and fourth items do go together. There continue to be what I'm now calling 3 legacy lawsuits from prior to my appointment where there was no insurance coverage for them. This is one of those 3. It's a claim under the Americans for Disability Act that arises out of the Warren County Jail for conduct that happened in April of 2017. It's a federal lawsuit that's ongoing. It's required a substantial amount of deposition work and support. My office is working in conjunction with outside counsel to try to keep the costs down. But this is why we have insurance coverage, because the costs are still substantial. What we're looking for is an additional increase from $40,000 to $60,000 for future attorney's fees. If we were going into executive session, I would probably inform you that I hope this will be the last request on this case. And I would give you the reasons why. My hope is that this will terminate without Warren County needing to participate in a trial
but I'll reserve that for a future executive session to discuss that in more detail. And then the next resolution is to adjust the budget code for that additional $20,000 to outside counsel to continue the defense of Warren.
So I need a motion for items 3 and 4. Supervisor Bean. The second, Supervisor Etu. Thank you. Any questions, comments? Seeing none, I'll call the question. All those in favor say aye.
Aye.
Any opposed? Seeing none, that carries. Discussion update, litigation.
I have 19 items list. I want to take about 5 minutes on each one. What I will do is I'll defer an executive session until our next meeting or at the board meeting. I do want to just hit one, which is the very last entry on the bottom of page 297. It's a notice of claim that we received August 8th of 2024. I want to hit that because you're not going to see it ever again. And the reason you're not going to see it ever again is the Board of Supervisors approved a part-time risk manager who knows how to deal with these claims. That came in on the 8th. It's already been closed. And Travelers is sending a denial letter on that claim to the claimant and their attorney because of the lack of liability in Warren County. It's the type of work and understanding of the insurance industry I do not have, and my office has not had the time to do. And we're going to see more of that as some claims come in, which the county just does not have liability. Let's take a much more proactive stance. What that does is that has an incredible positive impact on our appearance and rating for insurance going forward. Because we have less claims, less money to defend claims. We're not doing a 50H on something that doesn't need to have an examination performed with outside counsel. So my hope is we'll see more of those in the future. That's subject to any questions. That's my abbreviated report for the month.
Thank you, Larry. Any questions for the county attorney? Supervisor Driscoll.
Thank you, Chairman. Larry, is there any such mechanism for doing an executive session virtually, or whereas we would have to, I guess, log into an email in order to gain access to that and have those items covered electronically? I mean, is that something that's possible or ever gets done? Do you follow my question? Okay. Only the members of the committee or the board would have access to that information. It would be an email that, yeah, something that we would have to log into. And then if we had comments or questions, I guess there would be a way for us to reply to you or your office. And that may not even be an efficient way to address a matter, but I'm just curious if that's something that
It really wouldn't be an executive session. I mean, I can communicate in writing under an attorney-client communication privilege, which I often do in the form of legal opinions, occasionally with emails. So communicating by writing from me to you, I think is feasible and possible. I'm not sure about a back and forth.
Okay, all right.
Communication, that's just a little harder because then if there's a quorum participating, arguably that is a meeting, and a meeting would
Yeah,
have to be
right.
noticed. And if noticed, there would have to be an executive session to have the discussion. So I understand the question. I'm not sure we could follow it to its conclusion.
It's important stuff, and I recognize that at some point, you do have to do your presentation. We should be listening to you and asking questions. I was just wondering if there was a way to expedite that so that a meeting scheduled for 45 minutes doesn't go an hour and 45 minutes.
Often I'm asked how much time I need.
Yeah.
So the meeting length usually fits that unless there's some unique issue that pops
Okay.
up.
All right, thanks.
You're welcome. Any other questions? Seeing none. We voted on that? Mistaken? Okay, so nothing on pending items. Privilege of the floor.
Thank you, Mr. Chairman. I just had a question on the health insurance plan. I know Mr. Shuit isn't here anymore, but this was really the only opportunity other than interrupting the meeting, and I didn't want to do that. Question, so I'm realizing that the health insurance plan for the county is far more complex than the town level, especially considering it's self-insured, and I think it was unclear to me how much of that 11% increase was only from the prescription side of things. But what I just wanted to make mention of is at the town of Hague, and I'm sure other towns face the same thing, we traditionally always bought the platinum plan. And when it was presented to us this year, after I took office, it was just a massive increase, just the standard platinum plan insurance. We also had a separate option that was, well, multiple options, but the one that Mr. Shuit and I kind of identified as a good path forward was there was a high deductible plan that was a silver plan that was going up very minimally. And it was a $5,000 deductible. But what we discovered after running the numbers was that the town of Hague could pay for that $5,000 deductible for the employee, you know, so that they didn't have any deductible essentially, even though it was a deductible plan. And at that point, the town of Hague still was saving money, like guaranteed. There was no downside for the town of Hague in that manner. And the employee, especially for like the family plans and the married, you know, plan, and was saving tremendously. So effectively, we gave employees a really big raise by offering this plan where the town of Hague saved minimally because we were paying that $5,000 deductible. The employee got a raise that was significant by us offering them that plan. And that was a change that we made, that we offered to pay that deductible. And I don't know if this is applicable for the county. It was a little unclear in the presentation to me, but I would be remiss if I didn't communicate my thoughts in this manner. Thank you.
Josh, any comments, questions, any further comments, privilege of the floor? Seeing none, then there's nothing left on the agenda other than a motion to adjourn. Supervisor E2, Supervisor D, all those in